Good afternoon to all. At the outset, I would like to thank AIOC and BOS for providing me the opportunity to present my paper here. I don't have any financial disclosures, and my topic for presentation today is short posterior ciliary arteries distribution in normal eyes. So as we all know, the choroid is the most vascular layer of the eye, and apart from the choroid, it also supplies the outer layers of the retina. So any alteration or loss of the choroidal vasculature is also implicated in the pathogenesis of multiple chorioretinal diseases. SPCA are branches from ophthalmic artery. They pierce the choroid at the choroidoscleral interface, and they further branch into multiple smaller choroidal vessels. In this paper, we report the distribution pattern of SPCA in healthy eyes using SSOCT scans. So this is just a snapshot of our previous work in which we reported and validated the algorithm which is used in the current paper. So on the left side, we see that there is a OCT volume scan. From there, the software could detect the choroidal inner boundary and the choroid outer boundary. Subsequently, flattening of choroidal outer boundary was done. And with that, we could obtain the scleral en-face images just below the flattened choroidal outer boundary. So the present study was a cross-sectional study. We obtained volume scan 12 cross 12 mm, and it contained the 1024 cross-sectional SSOCT scans, and this was captured on Plex Elite 9000. Subsequently, the en-face scans were derived and using the sclerochoroidal interface at the site of SPCA entry, we manually identified the SPCA using the ImageJ software. So this is just a representative image. On the left side, we can see the total analyzed area. So the whole analysis covered an area of 144 millimeter square. Just for the sake of analysis, we also subdivided the area into 9 sectors. So we had 9 sectors like nasal, superior, central and inferior. Like that, we had foveal as well as temporal. So coming to the results, we analyzed a total of 68 eyes, and the age ranged from 19 to 89 years with a mean age of 58 years. BCVA was 2025 to 2020. Axial length was also within normal range, 24.2, and subfoveal choroidal thickness was 231.7 microns. What we noted was that the mean number of SPCA vessels was 2.64 with a standard deviation of 1.17, and the range was from 1 to 7. A point to note was that the majority of the eyes, that is 1/3 of the eyes, had only 2 SPCAs, and another 1/3 had 3 SPCAs. This is a slide in which we can see the en-face image. In the temporal central sector, we can see that the SPCA entry site is seen clearly with the yellow arrow, and on the right side we see the magnified image which shows the site of the SPCA entry. Also a point to note that not all hyporeflective areas had SPCA entry sites, as we can see here in the lower OCT scan as well as on the magnified image on the right side. The table above shows the distribution pattern of the SPCA vessels. It's clearly seen that the nasal central side, that is near the peripapillary area, and the foveal central, that is the area which covers the fovea, had the majority of the SPCA vessels. So overall, the foveal area, that is the foveal superior, central and the inferior, had around half of the total SPCA which we could identify through the algorithm. Statistically, we also noted that there was a weak positive correlation between the age and the number of SPCA vessels. The R square was 0.21, which explained that the 21% of the variability in SPCA quantification was adjustable. So discussion, we could see that the higher number of SPCA was seen in the elderly population, which is more than 70 years, as compared to the younger cohort, that is less than 40 or 40 to 70 years. We hypothesized that the increased detection rate could be related to the thinner choroid or better IR penetration of the OCT rays. Another point to note was that more than 2/3 of the eyes had only 2 or 3 SPCAs in whole of the 144 millimeter scanned area. This appears lesser when compared to the histological studies done in the postmortem eyes by Hyre et al., wherein they showed 10 to 20 SPCAs in normal population. What we also missed could have been the medial PCA branches which are located nasal to the optic disc. So just to conclude, our validated algorithm helped to visualize the SPCA over the posterior pole, including some portion of the peripapillary area, and the foveal central as well as the nasal central area had the maximum concentration of SPCA, which correlates well with the vascular pattern of the fovea, in which the fovea derives the maximum blood supply from the choroid. Thank you for the